The main challenges that I might have faced following the birth were, from medication point of view, the potential that I could have an infection, because there was a higher likelihood that I would have an infection or being on anti-TNF. The other concern was that, having stopped the anti-TNF in preparation for birth, was that I might flare very soon after birth. And if this was the case, how it was very difficult. And if I happened to flare, how would I then look after my child? I don't think that my disease changed hugely after I had my little girl. It stayed very, very stable, and I plan to go back onto my anti-TNF sort of round about between 4 and 6 weeks after birth. When I had the stitches taken out at day 10, everything looked very well. It was all healing really well. So I started back on the anti-TNF after 4 weeks. I planned to breastfeed, so I was unable to start back on my DMARDs at this time. So I just stayed on I've just been on monotherapy for that time. Some of my concerns after the birth of my daughter was that I would flare. So I was very sort of nervous that I wouldn't heal quickly and wouldn't be able to start back on my anti-TNF. Other concerns were that they would have an impact on her and her immune system, and whether that could sort of be detrimental to her health. I was given a lot of support from my doctors, specifically my rheumatology team, and they were pretty much on hand. They have a phone number that I can phone, and you always get call back within 24 hours unless it's the weekend. So they're really supportive and able to help if need be. I'd say that the health visitor and the midwives weren't familiar with the treatments that I was on. So when it came to her first set of vaccinations at 8 weeks, they were unable to answer those questions, and so I had to go to my doctors at the hospital and sort of ask them what their thoughts were on her having her vaccinations and whether there were any concerns about that. My advice to other women who have RA and who want to start a family is that it's not impossible, which I think a lot of women sort of maybe think in the early days, and it's not necessarily a complication if your disease is well managed, because if your disease is under control, then you are managed the same as any other woman who's pregnant. You have the additional treatment from an obstetrician, which you may not necessarily have if you were pregnant without any complications. But other than that, there wasn't anything that made it any more of a difficult pregnancy. And aside from, obviously, my point of view, having to have a caesarean, had that not been the case, had she been in the right position, then it would have been a normal birth, and there was no sort of additional staff that needed to be on hand from that point of view. I'd planned that I wanted to breastfeed my daughter. Prior to actually giving birth, I was quite open to, if I couldn't breastfeed, I would give her formula. It wasn't a problem. I was quite happy to go either way. The preference was that it would be breastfeeding, but if I couldn't, then that was fine. Having had my daughter, I then sort of decided that I did want to breastfeed, and I didn't want to give her formula at all. And I think your emotions are at that time are heightened anyway, and what you maybe thought pre-baby can completely change when the baby actually arrives. And so when she arrived and I was able to breastfeed, I was determined that I would continue with it. And fortunately, we both took to it quite well. It was I think it was a lot more relentless than I ever thought. I never sort of imagined that a baby would want to feed for 24 hours in a single day. But yes, so that I did breastfeed. I didn't have concerns from my disease point of view, because if my disease was under control, that shouldn't affect it. Breastfeeding is quite challenging, which I don't think many people tell you, and I think they probably don't tell you because I think it's the best way. Because if people told you how hard it was, then you probably wouldn't necessarily want to do it. I didn't have any challenges from my disease point of view, just the actual art, because I think it is an art. It's one of the most natural things in the world, but it's also one of the hardest things, because the baby has to sort of be in the right position, and it is quite, there's a knack to it. And it's very time consuming, and it's also very tiring because no one can take over and no one else can do it for you. So it means that you are the sole provider for the baby for that time. I enjoy breastfeeding because there's a bond, and I think it's such a special bond that you can't get sort of any other way. And I think it's something that between you and your child that no one else has. I enjoyed the convenience of it because it is so convenient, because especially when they're young. I mean, my daughter's 11 months now and I'm still breastfeeding, but when they're young and they're waking up throughout the night every hour, not having to get up and make formula is just the easiest thing, because I found certainly when she was very young, I used to bring her into bed with me, just because that was the easiest way to do it. So from a convenience point of view, the ease, the bonding, and it's also really cheap because it's free. So yeah.